Here. Did you know that there are 1 in 40 Ashkenazi Jews, regardless of family history, who carry a mutation for the BRCA gene? And most don't even know. When we look at the general population, apparently it's 1 in 160. And there's a lot of research being done into particular populations, which you'll be hearing about, and they estimate that those numbers are even higher in some of those specific populations. So we are really quite fortunate today to be hearing from Yodeah. We have several representatives, Dr. Liz Etkin-Kramer, Sandy Grossman, Gina Russ, and Sophia George. And they will share with us all of this information. And as I'm sure you saw, we are recording this so that we can share this with colleagues who were not able to make it here today. And I hope that you'll share this with them because this is important information for us as a Jewish community to know. So I will turn it over to Yodeah. By the way, I wanted to mention one thing before I turn it over. I want to congratulate Yodeah, because not only have they received funding from the Federation in the past through our women's grants, they are now receiving an annual contribution of $10,000 as a beneficiary agency. So we are very proud to have them as part of the family and look forward to hearing you.
Great. Thank you, Joy. And please know how much Yodeah appreciates Federation support and guidance and being with us and our partner every step of the way. It's a really very meaningful relationship for us and one that we are so grateful for and so appreciate. And really appreciate you all taking your time today. I'm sure Friday mornings are not the easiest time to dedicate an hour to this, but it is so important and we really wanted to share information with you. So I am going to get started and hopefully share my screen and this will work. Couple of housekeeping thoughts before we get started. One is, this program is being recorded. All participants, we suggest, are being muted. I don't know if you're able to do that, Shelby, but sometimes that's easier. And the best way to watch it is in speaker mode. We will open it up for questions at the end and encourage you to put any questions in the chat and we will go through it then, or we can simply open it up and have a discussion, whatever works best for you. But we really do want this to be participatory and address any concerns, questions, thoughts that you may have. I also want to be really clear that we are not providing medical or insurance advice. This is all for informational purposes only. So if there's something specific, while we will answer your questions, please know that it's important for you to communicate directly with your own physicians if there's something specific to you. We can provide overview information, but that legal jargon where we say you cannot rely on anything that may be strictly personal to you. And if you are having any technical challenges, which is usually me, please feel free to reach out to Shelby Klein, who at Federation, who I assume that you all know and is available to help you. So with that being said, let's get started. What I'd like to do is introduce you to our speakers today. And really what we want to do today is provide you with a high-level overview of how hereditary cancer impacts both the Jewish community and also the Black and Caribbean community, because you'll see there's many synergies there as well. And we know that so many of you are touching so many facets of our community here in Miami, being very diverse. And so we think it's important to bring the full picture in. So let me begin by introducing you to Dr. Liz Etkin-Kramer. Liz is a gynecologist in Miami Beach, and she is also the founder of Yodeah. So we are very grateful to her. Liz is an assistant professor at FIU, And she also serves on the board of ACOG. I don't really remember exactly what it stands for, Liz, so you can do that one. But the ACOG Presidential Task Force on Knowledge Gaps in Breast and Ovarian Cancer Risk Assessment and Genetic Testing for Hereditary Cancer Susceptibility Genes. Dr. Sophia George is an associate professor in the Division of Gynecological Oncology Cancer Control Program at the Sylvester Cancer Center, Comprehensive Cancer Center, Miller School of Medicine at the University of Miami. Dr. George has a strong background in cancer research, biotechnology, cell culture, global health, and life sciences, and has been particularly focused on hereditary cancers in the Black and Caribbean population. Dr. George is the recent recipient of grants from both the Zuckerberg Foundation and from Pfizer. So we are very lucky to have Dr. George in our community and spending time with us this morning. And Dr. Rabbi Lila Haas, who I assume many of you know. Lila is the Director of Adult Learning and Growth for SAGE and is also a Yodeah board member. So with that overview, Dr. Kramer, I turn it over to you.
Thanks, Sandy, and thank you very much to Federation for hosting this. I am very thankful for the support that we get from Federation's staff and funding, and we wouldn't be able to do that without your support. So I'm going to start by sharing my screen. And I'm going to show you, I have just a couple of slides. And this is just a general overview. Oh, good. Sometimes I share and I end up not seeing people. And I recognize that usually we say turn off microphones, and we do that, but I'm happy to entertain any questions after. So that's me. I don't have any conflicts of interest. I want to talk first about what hereditary cancer is. And hereditary cancer is a cancer that develops that's associated with a genetic predisposition to the development of cancer because of an abnormal gene that doesn't protect you or a person. It's inherited from either parent, mother or father. So that's very, very important because many times we just focus on the mother. And you only need to have one of those genes. So compared, remember when you had kids and we wanted to check you for things like Tay-Sachs or sickle cell or cystic fibrosis, you need two of those genes. That's not true in this case. And BRCA is the most well-known and well-studied one of these genes that if you have an abnormality on a mutation or pathogenic variant, depending upon who they're synonymous, increases the risk of cancer. And this is not an unknown thing. There are a lot of people in the community across the United States who have a BRCA mutation. Angelina Jolie, Matthew Knowles, Chris Everett was just found to have a mutation on a BRCA gene, which was life-saving for her. And of course, one of my favorite people, Gilda Radner, who died from BRCA-associated ovarian cancer. And that's what I hate. I hate cancer, and I hate the fact that there are genes out there that we could be tested for that are guidelines to prevent cancer, and people are not being tested. So we need to do a better job. But when we talk about cancer, like hereditary breast and ovarian cancer, we need to understand that most cancer is not related to a gene, one specific gene you can test for, but a large percentage may be. Familial is something that runs in the family without a known specific gene, and hereditary is a named gene. And when I teach, I always say, well, you know, if there's a statue of somebody and it has a name on it, that's important. It's the same thing with this. And up to about, in hereditary cancer, up to about 14% of breast cancers are due to one of these genes. And up to 25% of ovarian cancers are due to one of these genes. But if you look at a subset of the general population, just Ashkenazi Jews, and there's tons of data over the past 25 years that have shown this, up to 40% of ovarian cancers are due to a BRCA mutation alone in Ashkenazi Jews. And the problem is that ovarian cancer, and I teach this, ovarian cancer has no screening, none whatsoever. Ultrasounds, pelvic exams don't pick it up in an earlier stage like other cancers. So it's really important to know who's at risk for this, because there are different things that you would do to prevent cancer. And the guidelines that give us the data to say what to do are really quite successful in terms of cancer prevention and risk reduction. So most men and women who carry hereditary cancer genetic mutation don't know that they carry it. And the lifetime risk of cancer in these people who carry these genetic mutations on these hereditary cancer genes is markedly elevated. And I'll go through that a little bit more. The cancers often begin at younger ages before we would even think about cancer developing. And the elevated risk of cancers are seen in both men and women, regardless of family history. But, and this is the good part, if we know, we can take measures to prevent cancer, including increased screening, medicines, and surgeries. And then, of course, we can consider IVF, in vitro fertilization, to prevent this in future generations. And I was just told by somebody from Federation about a recent woman who was tested through Yodeah, found out she carried a genetic mutation, is planning on having children and making miracle babies. Another Federation entity that's under Federation's umbrella was very helpful in interest-free loans and getting her the support to do that. So it's really impressive how Federation has taken this under their umbrella and helped the whole, from A to Z, from soup to nuts with this. So the question is, who should be tested for these genetic mutations? Well, in the future, Sophia and I believe that everybody will be tested, and I can't say that's a bad thing, but currently there is specific criteria who should be tested. And in the criteria, I'm not going to go through all these, but the idea is if there's a strong family history, a personal history of certain cancers, or a strong family history of breast cancer, ovarian cancer, and especially at a young age, if there are multiple cancers, and it's not only breast cancer, if there's prostate cancer that's advanced, pancreatic cancer, it's guideline. But some criteria is based on ancestry alone, is specifically in Ashkenazi Jews, where if there's one of 4 Ashkenazi Jewish grandparents, which is the majority of Ashkenazi Jews in the United States, and by the way, Ashkenazi Jews are the majority of Jews in the United States, it is guideline. And to consider it as well for Caribbean, even though it is not guideline, because the numbers may even be more impressive than in Ashkenazi Jews. So let's go through the Ashkenazi Jewish aspect of hereditary cancer. 1 in 40 Ashkenazi Jews carries a BRCA mutation, which, as Joy told us, is markedly more elevated than general population. We think it's 4 times, if not 10 times more likely. Most individuals have no family history, and that's been shown in multiple studies, and they still have an increased risk of cancer, even with no family history. They have not been identified. It's thought that over 90% of hereditary cancer carriers have not been identified. And it is guideline to test, regardless of family history, if there's 1 of 4 Ashkenazi Jewish grandparents. And this is why. This is the reason why focusing on BRCA specifically, regardless of ethnicity, regardless of family history, the risk of cancer is elevated. And we usually think about women having this genetic mutation because the risk of cancer in women is markedly more elevated than in men. In fact, women who carry a BRCA mutation, they can have a 70% lifetime risk of breast cancer and a 50% lifetime risk of ovarian cancer. And those numbers are a little bit fluid depending upon family history as well, but it could be markedly high. Pancreatic cancer can be elevated. There are new guidelines for pancreatic screening that can pick it up at stages that can be life-saving because you can have surgery, as well as an elevated risk of melanoma. The risk of cancer in men may not be as high, although prostate cancer is pretty scary, and advanced prostate cancer and aggressive prostate cancer in men. So there are different things that you would do. So talking about this as a gynecologist, my goal is cancer prevention, to identify individuals who carry hereditary cancer genetic mutations before they are diagnosed with cancer, because they can take life-saving actions to prevent cancer. If I had my druthers, ideally, we want to identify these men and women by age 30 or even earlier if they're having children. I had a girl call me from Israel, my first time doing a telemed from Israel, who found out that she carried a BRCA mutation, and she's 21 or 22 years old because she's going to have kids. And we talked about that. IVF in Israel, I learned, is free. And you can know for other family members, because if you carry one of these genes, not only BRCA, but one of the other these hereditary cancer genes, there's a 50% chance that your family carries it. So it's really important to share. I'm a believer in sharing far and wide because it really can save lives. And again, pre-pregnancy planning is important, and possible in vitro fertilization for couples that carry one of the men or woman who carries this genetic mutation. And again, it doesn't mean that somebody who carries a genetic mutation in one of these genes, and looking at BRCA in particular, because the numbers are pretty impressive with that, it doesn't mean that cancer will develop. It's all about the risk assessment. Cancer, it doesn't mean cancer will develop, but the risks are markedly increased if these genes suggest that your prevention is not working well, your genetic prevention. And it allows me as a gynecologist to help prevent cancer, because otherwise I think that if I don't have a family history in my patient, and I know that they carry one of these genes, I'm going to think that they're at average risk of certain cancers like breast cancer, which the average risk is 13%. And the risk of ovarian cancer is only 1.3%. But if you carried one of these genes, such as BRCA, your risk of breast cancer is an impressive 70%. And ovarian cancer is up to 50%. And this is lifetime risk. And remember, there are different things you would do depending upon what risk group you fell into. So the question comes in, how do you get tested? Well, there are lots of ways to get tested. We at Yodeah try to make it easier because most physicians are not aware of this. We're working on that. And so we have testing that is available through our website. We don't get any, we don't make money on testing through the website. We have arranged with a clinical grade lab to do all of the testing. They get the results. We don't get the results, but you get the results, and you get access to a genetic counselor that helps tell you what to do with this information. And hopefully you'll bring this information to your physician to help you understand it in the context of your personal and family history. And we believe that knowledge is power. We want you to take action with this information. Learn more on the website, get tested. You go to yodeah.org. If you want to be tested, which we hope you do, there is a discount code that drops the testing currently down to $99. It's still that as of today through the lab. And that includes the access to a genetic counselor. You can connect us to other organizations locally as well as nationally and internationally to talk about this issue. And we want you to share this knowledge with friends and family members. Help us save lives, because the more we do this together as a community for our brothers and sisters, the better we are as a community. And one of the things that I've learned through my years is that Federation does look at this as a community issue. I know that JCS has taken over I think it's the 211 hotline for people at risk. You don't have to be Jewish to be at risk. But they've taken over it with their funding. So we do look at this as a community issue. And knowledge truly is power and can save lives. And I hope that this has helped. I'll take questions later, and I'll stop my share, and Sophia is going to talk. Dr. George is going to talk about her amazing research that I'm blown away with every single time I hear about it. So. Sophia, you have to unmute.
Do you see my presenter mode or the slides?
Slide.
Okay. So good morning.
No,
Thank you.
I'm sorry. Forgive me.
Should I swap?
Yeah.
Over?
It's in presenter view. Yeah.
There you
Perfect.
Thanks. So good morning, everybody. Thank you for being here to listen to what we're talking about in terms of hereditary cancers, in particular, what's happening in our population in South Miami, in South Dade. So as Liz has already, Dr. Kramer has already talked to you about the general information, and I'm going to talk to you about women, Black women, and also women for where I'm from, the Caribbean. And I have no relevant disclosures. So what do we know in general about breast and ovarian cancer in women of color, in particular Black women, is that they are disproportionately more likely to be diagnosed with breast cancer under the age of 40. Only about half of breast cancers in Black women are diagnosed at local stages compared to 64% of white women. So the cancers are usually aggressive and advanced stage. And that Black women have the highest death rates of all racial and ethnic groups, and are 42% more likely to die of breast cancer than white women. And of course, breast cancer is not only an issue in the Black population, but we are learning more and more that breast cancer is also an issue in the Hispanic population, Latina population. And of course, we know that the Latina population is heterogeneous, and therefore we need actually more work to understand that population as well. So why am I talking to you about this? The Miami has a long history of folks coming from the Caribbean and also African Americans who've been here clearly due to the slave trade. But Miami initially, and parts of Miami were established by Bahamians in the Coconut Grove. And we also know that about 50%, more than 50% of people who self-consider Black have Caribbean ancestry, in particular from Jamaica, Haiti, and the Bahamas. And then in the United States, Florida, again, is proximity to the Caribbean. We have the second largest population of Caribbean people, but the largest Haitian population, for example, and New York has the largest Dominican population. So Dr. Kramer already told you about the proportion of people who have inherited breast cancer in the United States, and specifically the Ashkenazi Jewish population. So we asked the question in the Bahamian population specifically, and that was really due to the types of patients that we saw at Jackson and at Sylvester Comprehensive Cancer Center. So we asked the question, well, what is the proportion of women who have breast cancer who have an inherited risk having a BRCA1 or BRCA2? So what we found was that about 24% of women diagnosed with breast cancer and ovarian cancer who are Bahamian have a mutation in BRCA1 and BRCA2. And in women who have a family history of cancer, about 1 in 35 have a mutation. And so as Dr. Kramer said, the populations, although very different and have different origins, have the same and similar challenge of one, identifying women who are, and families actually, at high risk for developing cancers and using preventative strategies to prevent these diseases. So we asked the question, well, what we found in the Bahamas, right, is it's also the same in other countries in the Caribbean. And we were fortunate to be funded by Susan G. Komen Foundation to do this work. And so we went to different countries in collaboration with local physicians there, Cayman Islands, Jamaica, Haiti, Dominica, Barbados, Trinidad. And what we found actually was that about 14% here, so 1 in 7 Caribbean women who had breast cancer had a mutation in BRCA1 or BRCA2. And so, of course, that makes us think about our Miami population, our South-Dade and Miami-Dade and Broward populations to ask, well, how are we going to be able to decrease the risk of cancers in these populations? And therefore, my speaking to you today and interacting and working with Yodeah for that same reason. So we can see that women from the Caribbean, families from the Caribbean also have high proportions of having a BRCA1 and BRCA2 mutation. And actually this arrow here just represents that we initially did not do work in the Dominican Republic, but we're doing that now to establish a proportion of people who have a BRCA mutation so that the country themselves and also us here in the US can have an awareness and therefore implement screening strategies for that population also. So at Miami, at Sylvester, because of the work that we have done, we have already implemented in the clinic when women come for their screenings, annual well visits, and men too, actually, that we ask, along with the Ashkenazi population, ask the question, are you an Ashkenazi Jewish person? You're also being asked now, are you a Bahamian? And that is because, again, of what we know, that the risk is really high to have, the chances are high to have a BRCA mutation, and that we can do things in the clinic to prevent cancer from being formed. And so in summary, our study suggested that people of the Caribbean diagnosed with breast and ovarian cancer have about 1 in 7 or 14% will have a genetic mutation. That testing is pivotal, that we need to know you need to know your status, and if you're positive, tell your family, as Dr. Kramer said, share, share, share. And that these information will help with screening for breast cancer, opportunities for risk-reducing surgeries like the removal of the fallopian tubes, testing of family members, and in general, cancer reduction in the entire family. And so I have one more slide, this is it. So just take home message, talk to both sides of your family about your family history, your health history, get tested. Talk to your doctor about your risk for breast and ovarian cancer. Talk to your doctor about which screening tests are right for you. And then, of course, if you are a woman, you should start having your mammograms as soon as it is it's available for you to do so. Know what's normal for you, make healthy life choices, and if you feel something, you say something, do something about it. So I'll stop here. Then we'll go on to the next speaker. Thank you.
Thank you, Sophia. Rabbi Haas, I turn it over to you.
Thank you so much. So I'm honored to be able to share my Yodeah story with all of you today. One of the reasons I am involved with Yodeah is because it's not just personal to me, but it is part of our family story. And sharing story in Judaism is critical. That's how we inform the next generation. That's how we maintain link to one another in this chain of tradition. And so my Yodeah story today hopefully will be one that will help each and every one of you make a decision that could potentially save your life, the life of your families, and also help to alter the course of your own life to have a long, healthy, blessed life. So about 8 years ago, I was serving as a rabbi in Birmingham, Alabama. I was 29 years old, and it was a particularly challenging year for the congregation. We lost 3 young mothers to cancer in that year. And I remember as we were standing at the graveside of these, with these families, holding on to their children, their small children. All of these women were in their late 30s. I stood there thinking, as these families were about to walk through the valley of the shadow of death, that for me, a moment of incredible darkness and pain, for me personally, was a call to action. It was important to me in that moment to uncover the story of my own family, knowing that my mother was a breast cancer survivor, thank God, that my aunt, a breast and ovarian cancer survivor. All of that knowledge was something that I knew and had on my heart, but it didn't compel me to action until that moment where I stood with these families. And so I got tested. I'll never forget opening the envelope and seeing the line that I had an 87% chance of developing breast cancer in my lifetime. And at 29 years old, that was powerful information. That was action for me. And so I met with my doctors, I met with my family. My family got tested, and it wasn't my mother who passed on the gene, the breast cancer survivor, it's my father. Many of you know my father, Cantor Stephen Haas. He is a BRCA carrier. His sister also is a BRCA carrier. And just so you know too, my sister and my brother are all BRCA positive. So the Haas family has strong genes. Unfortunately, strong BRCA genes. But we know about them. And so that has provided an incredible amount of perspective and power in our family to take action. So at 29, I was a single woman. I decided that I wanted to give myself the greatest gift I could, which was the gift of a long, healthy life. And I had a prophylactic double mastectomy. Fast forward a few years, I met Will, who we would get married, my husband. And when we decided that we wanted to have a family, we found out that the only way that we would be able to have a baby was through IVF. But knowing that we were only able to have a baby through IVF was also another blessing for us, because through in vitro fertilization, we have to screen all of the embryos for a number of genetic mutations, as well as the opportunity to screen the embryos for the BRCA mutation. We were able to harvest 9 embryos, but I want you to hear this. 8 of the embryos were BRCA positive and carried other genetic abnormalities and chromosomal abnormalities. So when the doctor called me and said, we harvest 9, but we have 1 embryo that's viable, I said, this is our blessing. This is our baby. And thank God, he's 20 months old, my little Asher. We're grateful. And I'm grateful that we actually stopped the transmission in our family of this genetic mutation. So we reversed generation to generation in our family. And so Asher will not carry the BRCA mutation. And 6 months later, after having Asher, I had a full hysterectomy so that I wouldn't have the opportunity of developing ovarian cancer in my lifetime. So why do I share all this with you? I mean, some of you I know, but we don't know each other that well to be sharing all of this info with you. But the reason I do, and the reason I'm part of Yodeah, is because not only is knowledge power, knowledge saves lives, but if somebody mentioned to me this past week on another call that we had with the foundation, they said, not only is knowledge power, knowledge saves lives, Lila, but courage makes it happen. And so for me, being able to help uplift and strengthen and hold all of you on this call with me, to be able to share this story, that maybe 1 or 2 or maybe more than that on this call will say, today's the day that I want to have this knowledge. Today's the day that I want to be empowered. Today's the day that I'm going to be brave. Any one of us as part of Yodeah will virtually hold your hand. We'll sit on the phone with you when you spit into the tube. Anything that you need for us to help you be strengthened, to find this information out. I promise you that it may seem frightening, and I validate that and I hear that. But do know that there is so much that you can do to give yourself the greatest gift of life, and also so many ways to be able to reverse the Lador Vador, to no longer pass this on from generation to generation, so that we can ensure a strong, viable, and healthy Jewish future for our children, for our children's children, God willing, and that we can help to eradicate BRCA from the generations to come. So thanks for listening. If you have any questions, please don't hesitate to ask. And we hope that, Yodeah, that this knowledge is something that will inspire you and will help you to take action with bravery, with courage, to leave a life of blessing.
Lila, thank you. As always, I've heard you tell your story many times, and each time you move me to tears, you move me to action, you remind me of why we're doing what we're doing and how important it is for us to communicate with each other, with everyone we come in contact with, and how vitally important this work that we're doing is. And okay, I'm emotional. So there's a number of questions that we want to address today, because there's nothing more compelling than the story that you just told us. But there are questions that people bring up to us many times, and there may be some questions that you all have. So before I address some of those questions, I would just want to open it up and ask you all, is there something compelling, something one of you wants to ask, or should I just dive into my questions for you guys? Okay, I'm diving in. So what are the questions?
Hold on, Sandy,
Yeah.
just want to make sure that you address, where can everyone get tested?
Okay, so thank you for asking that question, because we're going to put up a slide on that as well. If you go to our website, and I can share my screen and show you that slide now. Hold on, let me get there. www.yodeah.org, or you can take a picture of it now, and it'll take you to our How to Get Tested page. We take you directly to the testing page so you can order your test. I will tell you that when I first wanted to get tested about 10 years ago, the test was about $5,000, could only be done through your physician's office, and it was not covered by insurance. Today, that patent has run out. Thanks to Liz, who did a great job of identifying and negotiating with a lab called Color. We now get the test for $99. Okay, it is a simple spit test. You go onto the website, you order the test, it will be sent to your home. You simply spit in a tube. I know it's a little, weird to just be spitting, but we do it. You package it up and you send it right back to the lab. And in about 3 weeks, they will reach out to you with the results. And you'll be contacted by a genetic counselor if there's anything that they feel that they need to discuss with you. It's No30 is our code to get our discounted rate. And the reason it's 30 is because they test for 30 different genetic mutations, not just the BRCA.
Sandy,
Yeah,
I'm sorry to interrupt. They're up to 31. Just throwing it out there. But we didn't change the code. No.
Definitely not changing the code. We've got it everywhere. So please, we beg of you, we encourage you to go ahead and do that and share that code and our information with your circle, with your relatives, your friends, your family, with any organizations that you're involved with. We are happy to come speak. While we recognize that there were so many challenges and frightening aspects that came as a result of COVID, one of the blessings was that we transitioned to Zoom. So instead of just speaking to groups of 20 in person at a synagogue, we've been able to reach people around the world through Zoom presentations like this one. One we did last year with Max Weinberg, who is Bruce Springsteen's drummer, and his daughter, Allie. We had over 500 people on that call. Not only are we a nonprofit organization and we do not benefit in any way financially from you all testing, but we are 100% volunteer run. And so that's important because really our mission is to educate and test. We are about saving lives and really encourage you all to join us in this mission to save lives. So Joy, thank you. That was a very long-winded answer to where do I get tested, but I think it was important. One of the other questions that comes up quite often is, I'm 50 years old, 60 years old, I'm not having kids. Do I really need to test or have this information? Lila, you want to take that one and respond?
Sure. We really encourage everyone to test because the information that you get also helps if you have siblings or if you have children. You starting, it doesn't necessarily matter if you're not having children any longer, but if you already have children or if you have nieces and nephews or if you have a sibling, that information is powerful for all in your family to have. So we definitely, and for your grandchildren, I think that's very important. That's something that we always encourage people to do. So this is definitely something to share with your own parents as well, because that knowledge is powerful, really regardless of the stage of life.
Thanks, Lila. Liz, people ask a lot, a couple of things. One, does this automatically mean if I'm a BRCA carrier that I'm going to get cancer? And also, if I test through Yodeah, will you get the results and will you help me guide, how does that work? So you want to take those two kind of bundled questions?
Thank you. So the first question is, and again, I agree with what Rabbi Haas said about the importance of testing for children and for family, but also for your own cancer risk assessment too. Don't forget, if you're 85, I've had patients who are 85 years old and say to me, well, I don't have ovaries. Why am I testing? Well, if you're negative and your partner, the father of your child is negative, then your child's chance of having a BRCA mutation is 0.3%. So it really risk reduces. But the key thing about knowing the status, if you carry a BRCA mutation or other hereditary cancer mutation, is all about risk assessment. So again, it doesn't mean you're going to develop cancer, by no means, but your risk is higher. And if your risk is higher, there are different things as a gynecologist or a primary or whomever knows about this, God willing, more people will know about this. There are different things we'll recommend to keep you healthy. It's that simple. How am I going to keep you healthy? And if you have a 50% risk of ovarian cancer, and I don't know that, I'm not doing a really good job keeping you healthy because there's no screening for ovarian cancer. So the risk is elevated, and there are different things that we would do for that risk according to whatever risk group. And no, at Yodeah, we do not get the results. I've had patients say, who come to see me in the office, I tested through one of your speeches, and I say, okay, can you get me a copy of it, please? Because of HIPAA laws, we don't have copies. So I actually have to ask the patients to bring it in. So I have it charted. And I always, some of my patients say, oh no, you're so thorough. I think it's a little bit neurotic. I have to have a copy of the results in the chart, because unless I have a copy, I don't know. And Sophia, I'm sure you've had this experience when patient says, oh, I've had genetic testing, and it turns out it's tumor testing, or it's prenatal testing.
Or
have you seen that?
Or the results of the test that they misinterpreted.
Yes.
So there's a thing called variant of unknown significance, where it means that it's not a positive, and people interpret it as a positive, and they go ahead and do or want to do risk reducing surgeries and other interventions that are not yet clear, and so that's why you need to see it.
Yeah,
Right.
you always have to look at it.
Thank you. There's a couple of points I want to raise. And one of them, we are talking a lot about getting tested. We are all about getting tested. But we want to mention that this also potentially, there are insurance issues, okay, and challenges. Now, I'm going to actually read this because I have to make sure I get this right. But there is a federal law called GINA. In 2008, and it's not even named after our own GINA, which, is surprising, but in 2008, the Federal Genetic Information Non-Discrimination Act, or GINA, became law, which generally forbids health insurers from using genetic test results for decisions regarding rates or coverage. Okay, so they are not allowed to discriminate against you if you have genetic testing for health insurance. Now, that being said, there is also protection under the Affordable Care Act and state law for this. But GINA does not extend to life, disability, or long-term care insurance. These types of insurance are regulated by state law. Now, fortunately for us, in Florida, they enacted a law that states that in the absence of a diagnosis of a condition related to genetic information, life and long-term care insurers may not cancel, limit, or deny coverage or establish differentials in premium rates based on such information. So see, there is an upside to living in Florida. You are protected. But what we want you to do and suggest people do is make sure your insurance is in place before you do this, right? At this point in our lives, many of us already have this insurance in place, so it won't be an issue. For some of our younger children or colleagues or friends, they may not have all of their insurance in place. This is another upside to making sure we're testing the parents or our generation, because if I'm negative and the father of my child is negative, my child doesn't need to worry about this, and I don't have to worry about the impact on their insurance. We are not giving, remember, we're not giving medical or insurance advice, but we want to make you aware of this so you don't inadvertently, you're 28 and you go get tested and now it's in part of your medical record and you could have an issue. We just feel that we need to mention it, and it would be irresponsible of us not to put it out there. So keep that in your back pocket, but know at the end of the day, it's really most important that you get tested, right? Because you don't want to let something like that be a gating factor for what could potentially impact the rest of your life. So again, we encourage that. I know that we are running short on time. You all have been very patient. I wanted to open it up. See, are there any other questions before we wrap up? You can unmute yourself for an intimate enough group.